Good morning. This is Follow the Science Monday morning COVID-19 update. I'm Dr. Paul Juarez, professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College, and also principal investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL. Today is Monday, February 7th, 2022. I'm going to start by providing an update on where we are nationally, after which I'm going to spend some time talking about the transition of COVID-19 from a pandemic to an epidemic state. Then I'm going to talk about long COVID, a range of new, returning, or ongoing symptoms after initial COVID-19 infection. And finally, I'm going to provide an update of where we are in Tennessee and conclude by providing some thoughts of where things are headed. Overall, the outlook on COVID-19 continues to improve. The data clearly show that new rates of COVID-19 have dropped in 48 of 50 states over the past 2 weeks, although current levels and rates vary dramatically by region and state. Nationally, new cases of COVID-19 are down 57% in the past 2 weeks. New cases are now under 300,000 per day, as compared to over 800,000 at the peak in December. In 37 states, the decrease in new COVID-19 cases over the past 14 days is down by 50% or more. The two states in which rates are continuing to increase are Maine and Montana. As has been the case since vaccines became available, rates have dropped fastest and are lowest in states with higher vaccine and booster rates. In more good news, hospitalizations nationally have decreased by 23% over the past 14 days and are down in 40 of the 50 states. Regionally, hospitalizations due to COVID-19 are highest in western states, including Montana, Idaho, Oregon, and Alaska. In contrast with a decline in new cases and hospitalizations due to COVID-19, deaths are up 18% over the past 14 days and remain over 2,500 per day. Total deaths nationally from the inception of the pandemic are now over 900,000. Deaths from COVID-19 are highest in southern states, including Mississippi, South Carolina, Ohio, and Tennessee. If there is a silver lining in these data, however, it's that deaths from COVID-19 appear to have peaked nationally and are beginning to go down in most states. This is in line with historical trends, which has shown that the change in hospitalization rates lag new cases by 2 weeks and 4 weeks for deaths. I anticipate that over the next 2 weeks, we will see significant declines in all three COVID indicators: new cases, hospitalizations, and deaths. If not for all, then in most states. While this is good news indeed, it does not mean that we have seen the end of COVID-19 or its impact. In the past few months, increasingly, we have heard that COVID-19 is moving from a pandemic to an epidemic state. To an epidemiologist, an endemic state is one in which overall rates are static, not rising, not falling. Yet it is not clear what static looks like. What would be the ongoing case rate, morbidity levels, or death rates? This is all crucial to understanding how much of a population and which sectors will be susceptible going forward. Susceptibility will depend on the interplay of a population's behavior, vaccine and booster rates, demographic structure, susceptibility, and immunity, plus whether viral variants emerge. Different conditions across the world are likely to allow more successful variants to evolve, and these concede new waves of epidemics. To this extent, the future of COVID-19 in the United States is closely linked to how it is handled and or evolves in other countries of the world. Therefore, thinking that a COVID-19 epidemic will be both mild, that a COVID-19 endemic will be both mild and inevitable is more than wrong. It is dangerous. It sets us up for many years of disease, including unpredictable waves or outbursts. It is more constructive to consider how bad things could get if we keep giving the virus opportunities to outwit us. This means continued efforts to get everyone vaccinated and boosted will be needed. The other major concern about COVID-19 is the long-term effects it has on persons who have been infected with the virus one or more times. This past December, Arcadia, a data science research company, released the results of a study that was conducted using aggregated, de-identified longitudinal patient data, which represented the health history of more than 150 million patients from thousands of electronic health records and claim data from all over the United States. Their analysis of long COVID based on COVID-19 infection and vaccination data over a period of 15 months from February 2020 to May 2021 included over 1 million persons infected with COVID-19, of which more than 240,000 had available a complete longitudinal history prior to the pandemic, as well as at least one encounter with a healthcare provider at least 8 weeks after their COVID-19 diagnosis. Results of their research found persistence or emergence of symptoms from an acute infection, i.e., long COVID, affects as many as 1/4 of all people who have been infected by COVID-19, and in many, symptoms can last for months and or be debilitating. Common signs and symptoms that linger over time include fatigue, shortness of breath or difficulty breathing, cough, joint pain, chest pain, memory, concentration, or sleep problems, muscle pain or dizziness, muscle pain or headaches, fast or pounding heartbeat, loss of smell or taste, depression or anxiety, fever, dizziness when you stand, and worsened symptoms after physical or mental activities. However, their research also found that vaccination against COVID-19 reduces the likelihood the patients will experience long COVID symptoms in the event that they are infected. Their data suggested that a single dose of a COVID vaccine, even if received after the patient is diagnosed with COVID, still correlates with a reduced likelihood of presenting long COVID symptoms. Patients who received at least one dose of any of the 3 COVID-19 vaccines, that's Pfizer, Moderna, or Johnson & Johnson, prior to a diagnosis were 7 to 10 times less likely to report 2 or more long COVID symptoms compared to unvaccinated persons. Their research even found that patients who are first vaccinated after they are diagnosed with COVID are still less likely to experience multiple long COVID symptoms compared to patients who remain unvaccinated. Unvaccinated persons who get COVID are 4 to 6 times less likely to experience long COVID effects if they are vaccinated within a month of after diagnosis, and 3 times less likely if vaccinated within 2 months of diagnosis. These findings provide conclusive support for the need for unvaccinated persons to get vaccinated to decrease their risk of long COVID symptoms. Now, let me turn my attention to Tennessee. Newly reported cases of COVID-19 over the past 2 weeks are down statewide by 33%. However, an increase in new cases of COVID are still being reported in over half of the counties of Tennessee. Over the past 14 days, the greatest increases in new cases of COVID-19 were reported in Van Buren County, up 131%, Morgan County, up 86%, Jackson County, up 82%, Humphreys County, up 72%, and Scott County, up 70%. The greatest decline in newly reported cases of COVID-19 over the past 14 days in Tennessee counties was seen in Davidson County, down 48%. Other counties experiencing at least a 40% decrease in new cases of COVID-19 over the past 2 weeks include Obion, Crockett, Lake, Haywood, and Fayette counties. Hospitalizations, however, were up 1% over the past 2 weeks. A close look at the daily data reveal that hospitalizations are all over the map. Hospitalizations were up over the past 2 weeks by over 100% in 5 Tennessee counties, led by White County, up a staggering 450%, Warren County, up 207%, Van Buren County, up 197%, and Houston County, up 191%. On the other hand, hospitalizations overall were down in 7 counties, led by Clay County, down 28%, Robertson County, down 14%, and Cook County, down 9%. The takeaway, however, is that statewide hospitalizations appear to have peaked in the past week and are clearly trending downward. However, hospitalizations are likely to continue to increase in some counties for the near future. COVID deaths in Tennessee over the past 14 days were down 2%, yet still occurring at an unacceptably high rate of 76 per day. Tennessee ranks 4th among all states nationally for COVID-19 deaths per 100,000 of the population. At the same time, the percent of fully vaccinated people in the state continues to be stagnant at 53%. This figure has changed little over the past month and represents a significant reservoir of people who are at risk of getting COVID and experiencing long COVID symptoms if they get infected. And thus, our efforts to get our unvaccinated neighbors must continue. To get our unvaccinated neighbors vaccinated must continue. So once again, that's all for today. Thank you. This is Dr. Paul Juarez from Tennessee SEAL and Meharry Medical College. And follow the Science Monday COVID-19 update. I'm signing off. Until next week, be safe.